Question 1. What is the generic name for the brand name drug Lipitor? A. Simvastatin. B. Atorvastatin. C. Rosuvastatin. D. Pravastatin. Answer: B. Atorvastatin. This question tests your knowledge of common brand and generic drug names, which is crucial for avoiding errors in the pharmacy. Lipitor is a widely prescribed medication used to lower cholesterol, and the keyword generic name asks for the official non-proprietary name. Atorvastatin is the correct generic equivalent, belonging to the statin class of drugs. For example, a prescription might be written for Lipitor, but the pharmacy might dispense atorvastatin if permitted, so knowing they are the same medication is vital. Remember that brand names are capitalized and unique, while generic names are lowercase and identify the active ingredient. Question 2. A prescription calls for amoxicillin suspension 250 mg per 5 ml. The dose is 500 mg 3 times daily for 10 days. How many ml should the patient take per dose? A. 5 ml. B. 10 ml. C. 15 ml. D. 20 ml. Answer: B. 10 ml. This is a basic dosage calculation question, requiring you to determine the volume needed for a specific dose given the concentration of a liquid medication. The question provides the concentration, 250 mg in every 5 ml, and the ordered dose, 500 mg, and you need to find the corresponding volume in ml. To solve this, set up a proportion, 250 mg / 5 ml equals 500 mg / x ml. Solving for x, you find that 500 mg requires 10 ml. Practicing these simple ratio problems is key to safely dispensing liquid medications. Question 3. According to federal law, which of the following is a Schedule II controlled substance? A. Ativan, lorazepam. B. Valium, diazepam. C. OxyContin, oxycodone. D. Xanax, alprazolam. Answer: C. OxyContin, oxycodone. This question assesses your understanding of controlled substance classifications under federal law, which is essential for proper handling, dispensing, and inventory management. Schedule II drugs have a high potential for abuse with severe psychological or physical dependence. OxyContin, containing oxycodone, fits this description and has strict regulations, including requiring a written prescription with no refills allowed. Drugs like lorazepam, diazepam, and alprazolam are typically classified as Schedule IV, indicating a lower, but still present, potential for abuse. Understanding these schedules helps ensure legal compliance and patient safety. Question 4. What is the primary purpose of a Material Safety Data Sheet, MSDS, now commonly called a Safety Data Sheet, SDS? A. To provide patient drug information leaflets. B. To detail the safe handling and properties of hazardous chemicals. C. To document patient allergies and medical conditions. D. To track inventory of controlled substances. Answer: B. To detail the safe handling and properties of hazardous chemicals. This question focuses on safety protocols in the pharmacy, specifically related to hazardous materials. The keyword MSDS, or SDS, refers to a standardized document providing crucial information about potential hazards associated with a chemical product and how to handle it safely. These sheets are vital for protecting pharmacy staff from exposure to potentially dangerous substances used in compounding or present in certain medications. They include details like physical data, toxicity, health effects, first aid procedures, and storage recommendations. Knowing where to find and how to use SDS sheets is a fundamental safety practice. Question 5. The abbreviation NPO is a medical order meaning: A. take as needed. B. By mouth. C. Nothing by mouth. D. At bedtime. Answer: C. Nothing by mouth. This question tests your knowledge of common medical abbreviations used in prescriptions and patient charts, which is critical for accurate interpretation of orders. The abbreviation NPO comes from the Latin phrase nil per os. The concept being tested is understanding standard medical shorthand. Nothing by mouth means the patient should not eat or drink anything, often ordered before surgery or certain medical tests. It is crucial to correctly identify this abbreviation to prevent serious harm to the patient. Make sure to learn the most common pharmacy and medical abbreviations to avoid errors. Question 6. Which organization is responsible for accrediting pharmacy technician training programs? A. FDA. B. DEA. C. ASHP. D. BOP. Answer: C. ASHP. This question assesses your knowledge of key organizations within the pharmacy profession and their roles. ASHP stands for the American Society of Health System Pharmacists, and one of their significant roles is establishing standards and accrediting pharmacy technician education and training programs. The FDA regulates food and drugs, the DEA enforces controlled substance laws, and boards of pharmacy, BOP, regulate pharmacy practice within individual states. Knowing which organization does what is important for understanding the structure and oversight of pharmacy practice. Question 7. What is the correct abbreviation for twice daily? A. QD. B. BID. C. TID. D. QID. Answer: B. BID. This question tests your familiarity with common dispensing abbreviations used to indicate the frequency of medication administration. BID stands for bis in die, which is Latin for twice a day. Understanding these abbreviations is vital for accurately translating a prescription order into dispensing instructions for the patient. For example, a prescription for amoxicillin 500 mg BID means the patient takes the medication 2 times each day. Always clarify with the pharmacist if an abbreviation is unclear to prevent medication errors. Question 8. A prescription reads lisinopril 10 mg number 30, take 1 tablet by mouth daily. If the patient has 1 refill remaining and is compliant, how many tablets will they receive in total over both fills? A. 30. B. 60. C. 90. D. 120. Answer: B. 60. This question requires a simple calculation based on the quantity dispensed and the number of refills authorized on a prescription. The initial prescription is for 30 tablets with instructions to take 1 daily. The problem states there is 1 refill remaining, meaning the patient will receive the initial fill plus 1 additional fill of the same quantity. Therefore, the total number of tablets received is the initial 30 plus the 30 from the refill, totaling 60 tablets. Pay close attention to the number of refills specified on the prescription. Question 9. Which of the following is an example of a medication route of administration? A. Tablet. B. Capsule. C. Intravenous. D. Suspension. Answer: C. Intravenous. This question tests your understanding of how medications are given to patients, known as the route of administration. While tablet, capsule, and suspension are dosage forms, the physical form of the medication, intravenous, refers to administering the medication directly into a vein. This is a specific way the medication enters the body to reach the bloodstream. Common routes include oral, by mouth, topical, on the skin, and injection, like intravenous or intramuscular. Identifying the correct route is crucial for proper labeling and patient counseling. Question 10. HIPAA is a federal law that primarily protects A. Pharmacy profits, B. Patient health information, C. Drug manufacturers, D. Pharmacy technicians. Answer: B. Patient health information. This question assesses your knowledge of important federal laws governing pharmacy practice, specifically focusing on patient privacy. HIPAA stands for the Health Insurance Portability and Accountability Act, and its main purpose is to protect the privacy and security of individuals' protected health information, PHI. This means pharmacies must take steps to ensure patient medical records and personal information are kept confidential. For example, you cannot discuss a patient's prescription information with unauthorized individuals. Protecting patient privacy is a critical ethical and legal responsibility. Question 11. Which of the following is a common side effect of opioid pain medications? A. Diarrhea, B. Constipation, C. Increased heart rate, D. Insomnia. Answer: B. Constipation. This question tests your knowledge of common adverse effects associated with frequently prescribed drug classes. Opioid pain medications are well known for causing constipation because they slow down the digestive system. While side effects can vary, constipation is a very common and often troublesome issue for patients taking opioids. Being aware of common side effects helps you answer patient questions and identify potential problems. Always refer patients experiencing significant side effects to the pharmacist. Question 12. A pharmacist asks you to prepare a sterile compound. Which area of the pharmacy is specifically designed for this purpose? A. Outpatient dispensing area, B. Inventory storage room, C. Clean room, D. Over-the-counter section. Answer: C. Clean room. This question focuses on the specific areas within a pharmacy designated for particular tasks, particularly sterile compounding, which requires a controlled environment. A clean room is a specially designed and controlled environment with strict air filtration and cleaning protocols to minimize the risk of contamination by microorganisms. This is essential for preparing sterile products like force solutions or ophthalmic medications. The other areas listed are used for dispensing, storage, or over-the-counter sales, not sterile preparations. Understanding the purpose of different pharmacy areas is important for workflow and safety. Question 13. What is the brand name for the generic drug escitalopram? A. Zoloft, B. Prozac, C. Lexapro, D. Celexa. Answer: C. Lexapro. This question tests your ability to associate generic drug names with their corresponding brand names, a fundamental skill for pharmacy technicians. Escitalopram is an antidepressant medication, and its common brand name is Lexapro. While Zoloft, sertraline, Prozac, fluoxetine, and Celexa, citalopram, are also antidepressants, they are different medications. Knowing these pairings is crucial for accurate order entry and dispensing. Many pharmacies use both brand and generic names, so recognizing both is essential. Question 14. Which type of balance is typically used for weighing small amounts of potent or hazardous substances? A. Counterbalance, B. Triple beam balance, C. Electronic balance, D. Class A torsion balance. Answer: D. Class A torsion balance. This question relates to pharmacy compounding and the tools used for accurate measurement. A Class A torsion balance is a specific type of balance designed for weighing small amounts of material with high accuracy, typically down to 6 milligrams. It is often required by law for weighing ingredients used in compounding prescriptions, especially for potent drugs. While other balances exist, The Class A torsion balance is the standard for ensuring precision in small-scale compounding. Accurate weighing is critical for patient safety in compounded medications. Question 15. A prescription calls for prednisone 10 mg tablets. Take 1 tablet by mouth daily for 5 days. How many tablets should be dispensed? A. 1. B. 5. C. 10. D. 50. Answer: B. 5. This is a simple dispensing calculation based on the duration of therapy. The prescription specifies take 1 tablet by mouth daily for 5 days. To find the total quantity needed, you simply multiply the number of tablets per dose, 1, by the number of doses per day, 1, and then by the number of days, 5. This calculation yields a total of 5 tablets. Always calculate the exact quantity needed based on the dose and duration specified to avoid dispensing too much or too little medication. Question 16. What is the function of a drug formulary? A. A list of drugs approved for use by an insurance plan or hospital. B. A database of all drugs approved by the FDA. C. A guide for identifying unknown pills. D. A record of patient prescription history. Answer: A. A list of drugs approved for use by an insurance plan or hospital. This question introduces the concept of a drug formulary, which is important in managing medication costs and access. A formulary is essentially a list of medications that an insurance company, hospital, or healthcare system prefers to cover or stock. Drugs on the formulary are often available at a lower cost to the patient or institution. Understanding formularies is key when processing insurance claims or managing hospital inventory. Patients may need to switch medications if their prescribed drug is not on their insurance formulary. Question 17. Which federal agency is responsible for the enforcement of the Controlled Substances Act, CSA? A. FDA, Food and Drug Administration. B. FTC, Federal Trade Commission. C. DEA, Drug Enforcement Administration. D. CDC, Centers for Disease Control and Prevention. Answer: C. DEA, Drug Enforcement Administration. This question tests your knowledge of the federal agencies that regulate pharmacy practice, specifically concerning controlled substances. The DEA is the primary federal agency responsible for enforcing the laws and regulations regarding controlled substances, including their manufacturing, distribution, and dispensing. This involves tracking controlled substance inventory, investigating drug diversion, and ensuring pharmacies comply with CSA regulations. The FDA approves drugs, the FTC deals with consumer protection, and the CDC focuses on public health. Question 18. A medication label states store at room temperature. What is the acceptable temperature range for room temperature in degrees Celsius? A. 0 to 4 degrees Celsius. B. 2 to 8 degrees Celsius. C. 15 to 30 degrees Celsius. D. 35 to 45 degrees Celsius. Answer: C. 15 to 30 degrees Celsius. This question relates to proper medication storage requirements, which are crucial for maintaining drug stability and effectiveness. Room temperature, as defined in pharmacy, refers to a controlled temperature range that is generally between 15 and 30 degrees Celsius, 59 to 86 degrees Fahrenheit. Storing medications outside their recommended temperature range can cause them to degrade, reducing their potency or potentially making them harmful. Always check medication labels for specific storage instructions. Question 19. What is the primary goal of a quality assurance program in a pharmacy? A. To increase pharmacy profits. B. To reduce medication errors and improve patient safety. C. To track employee performance. D. To manage inventory levels. Answer B. To reduce medication errors and improve patient safety. This question focuses on the purpose of quality assurance, QA, in the pharmacy setting, which is centered on ensuring patient safety. A QA program involves systematic activities designed to monitor and evaluate pharmacy processes with the goal of identifying and preventing errors before they reach the patient. This includes checking prescriptions for accuracy, verifying patient information, and implementing procedures to minimize risks. The ultimate goal is to provide safe and effective patient care. Question 20. The generic name for Norvasc is A. Lisinopril, B. Amlodipine, C. Metoprolol, D. Valsartan. Answer B. Amlodipine. This is another question testing your knowledge of common brand and generic drug names. Norvasc is a widely used medication for treating high blood pressure and angina, and its generic name is amlodipine. Lisinopril, metoprolol, and valsartan are also blood pressure medications but are different drugs with different generic names: Prinaval/Zestril, Lopressor/Toprol XL, and Diovan, respectively. Continuously studying brand and generic names is essential for passing the PTCB exam and working accurately in a pharmacy. Question 21. A prescription calls for cefdinir 250 mg per 5 ml suspension. You need to dispense a 10-day supply, taking 10 ml daily. What is the total volume in ml that you should dispense? A. 50 ml, B. 100 ml, C. 150 ml, D. 200 ml. Answer B. 100 ml. This calculation question asks for the total volume of a liquid medication needed for a specific duration of treatment. The prescription requires 10 ml per day for 10 days. To find the total volume, simply multiply the daily volume, 10 ml, by the number of days, 10. This calculation gives a total volume of 100 ml. The concentration, 250 mg per 5 ml, is provided but is not needed for this specific calculation. Always read the question carefully to determine exactly what needs to be calculated. Question 22. What is the purpose of a drug utilization review, DUR? A. To verify patient insurance coverage. B. To check for potential drug interactions, contraindications, or therapy duplications. C. To count and verify the accuracy of medication inventory. D. To prepare medication for dispensing to patients. Answer B. To check for potential drug interactions, contraindications, or therapy duplications. This question introduces the concept of a drug utilization review, DUR, a critical step in ensuring patient safety and appropriate medication use. A DUR is a review conducted by the pharmacist, often with assistance from the technician, to identify potential problems with a prescription, such as a medication interacting with another drug the patient is taking, a contraindication, a reason why the patient should not take the medication, or if the patient is prescribed multiple medications for the same condition unnecessarily. Performing DURs helps prevent medication errors and adverse effects. Question 23. Which of the following pieces of information is not typically required on a prescription label dispensed to a patient? A. Patient's name. B. Pharmacy address and phone number. C. Prescribing physician's DEA number for non-controlled substances. D. Drug name, strength, and quantity. Answer C. Prescribing physician's DEA number for non-controlled substances. This question tests your knowledge of the essential information that must be included on a prescription label for the patient, as required by law for safety and identification. While the patient's name, pharmacy information, and details about the medication itself are all required, a physician's DEA number is typically only required on prescriptions for controlled substances, not for non-controlled medications dispensed to the patient. The DEA number is primarily for tracking controlled substances by regulatory agencies. Knowing label requirements is crucial for accurate and compliant dispensing. Question 24. What does the abbreviation PRN mean on a prescription? A. Take every morning. B. Take after meals. C. Take as needed. D. Take before bedtime. Answer: C. Take as needed. This question tests your understanding of another common dispensing abbreviation. PRN stands for pro re nata, which is Latin for as needed. This indicates that the medication should only be taken when the patient experiences a specific symptom or condition, rather than on a fixed schedule. For example, a pain medication prescribed PRN means the patient takes it only when they feel pain. Correctly interpreting PRN is vital for instructing patients on how and when to take their medication. Question 25. The process of adding a diluent to a powdered medication to create a liquid form is called A. Compounding. B. Reconstitution. C. Trituration. D. Levigation. Answer: B. Reconstitution. This question focuses on a specific process commonly performed in pharmacies when preparing certain medications, particularly antibiotics. Reconstitution is the process of adding a liquid, diluent, such as sterile water, to a powdered drug to make a solution or suspension. This is often done for medications that are not stable in liquid form for extended periods. Compounding is a broader term for preparing customized medications, while trituration involves grinding a substance to a fine powder, and levigation is used to reduce particle size in ointments or creams. Knowing the term reconstitution is important for preparing liquid medications correctly.